Hey, how's it going? Welcome to Crush Your Mountain. Guess what? Our next guest is an amazing woman, Dr. Carley Berolzheimer. She is a doctor of physical therapy, and she's going to talk about several different points in terms of our jaw muscles and protecting our jaw muscles, why that's important. We're going to find out exercises that we can do to protect and even heal our joints if you're experiencing any discomfort and things of that nature. As we get older, these things become a problem. So pay close attention. If you find that this information is of value to you, please, by all means, like and subscribe and hit the comments below so that we know what you'd like to see more of, what you want more information about, and if you'd like personal focus on something that might be happening in your life. See you in a little bit. Hello and welcome to Crush Your Mountain. I am so thrilled to have with me probably one of the most knowledgeable women in the field of physical therapy, next to her partner that we had on a few months ago, and we'll talk about that too. But this is an incredible young lady. She is a North Carolina native. Carley Berolzheimer, welcome to Crush Your Mountain.
Thank you, Henry. I'm happy to be here.
The thing that really sparked this interest was noticing some jaw discomfort and talking to others. I've come to realize that so many individuals have problems with not just joint health in the lower body, but they normally don't take into consideration what happens above the neck and how that relates to getting older and things like that. So what actions stress our jaw muscles?
So our jaw muscles are basically in control of our chewing and our control of our mandible here in our jaw. So when we think about stress, you could define stress as just work in a way. And so the things that kind of stress that area would be anytime that we're chewing and eating, which is not necessarily a bad thing. Sometimes we think of stress as just a negative thing, but it's just a way of kind of working that area. So eating tougher foods are going to be a little more stressful or more of a challenge for those muscles, but that's what they're built to do. The other side of it is actually when we are stressed, kind of more the negative stress that we tend to think about. A lot of us tend to clench our jaw and grind our teeth a little bit, and that can, at some point, provide a little too much load to the jaw and get us into a little bit of trouble in terms of pain, discomfort, that kind of thing.
So basic chewing, especially the heavier foods, the more denser foods, and things of that nature, but also outside stress, things that might make us grind our teeth, might make us clenched up a bit, things like that. Um, you know, have you seen some of those teeth clenchers? Those people who tend to they get angry, drop like this. You know that. You know, I used to run into a number of individuals who do that. For some reason, especially in New York, they tend to do that. I don't know why. But that can be a very high stress environment.
Yeah, for sure.
And so that's one of the things. Are there illnesses, though, that directly affect our jaw muscles and cause ligament damage?
Well, thinking about that, you kind of think about the jaw is another area of our body. And you're right, a lot of us tend to sort of think neck down when we think about our musculoskeletal system, but the jaw is another part of that musculoskeletal system. And so, any illnesses that might negatively affect the musculoskeletal system. So, thinking about like autoimmune disorders, things that create just generalized increased inflammation, and increased stress on the body, those things can also have an effect on the muscles and the ligaments of the jaw, just because, like other areas of the body, they're just muscles and ligaments in another area. So things like that can um, can create issues or ligament damage in the jaw itself. Going back to like the first question with the stress, sometimes if we tend to clench or grind our teeth without knowing it or doing it in excessive amount, that can actually cause a little bit of potential like overload to the area. So that can get us into, a lot of us know the term tendonitis, where we've overused a muscle tendon unit. We can kind of have versions of that happen in the jaw as well. Again, just kind of based on overuse. And in the jaw, oftentimes that overuse can kind of happen without our direct knowing it or direct control, because a lot of us tend to grind our teeth and clench our teeth at night when we're sleeping.
Oh yeah, yeah. And my brother had that issue when he was a baby, and they actually had to give him something for that. So I certainly understand that. But now, how would someone tell or differentiate which one is which if it's inflammation or maybe something else that might be the underlying problem?
Well, we kind of go about it the way that we go about it again in any other area of the body. So when you look at the musculoskeletal system, some of the big things that we think about or that we look at are both flexibility or mobility, and then also strength. And so we can kind of differentiate some of those things. Sometimes, you have some salivary glands in this area that can sometimes get irritated. If you have a salivary gland issue, you may not see the limitations in mobility of the jaw, so limited opening or kind of excursion of the jaw. You may not see some of those limitations with a salivary gland issue, perhaps, that you would see if it's actually directly related to that temporomandibular joint itself. So it's kind of, we call that kind of differential diagnosis, but there can be nerve issues like Bell's palsy, where you have that kind of palsy, or I'm blanking on the term that I really want to use, but the kind of inhibition of the facial nerve, and you have that drooping of the facial muscles. And so we just we go through different tests and measures, and again, look at, can you open it? Can you close it? Can you move it in these different directions? Is any of that bothering you? We might even feel into that jaw area a little bit, and that gives us a better idea of if the issue is coming from the jaw itself, that joint, or if it's coming from something else.
Wow. So tell me this, what are 3 exercises that a person can do to protect their jaw? If you want to give more, do that. But if you got 3, that would be great.
Well, like anything, which nobody likes this answer, but everybody is going to be different with that, right? So if you're actually having a jaw issue, the things that I might recommend would be different than somebody who's not actively having an issue. Or if your trouble is more of a mobility restriction in the opening direction, I would give you something specific to that. Whereas somebody who doesn't have that, we might choose something else. But that being said, generally we want to think about, again, we think about this in other areas of the body, but can you keep the motion and keep yourself moving in these different directions? So the jaw, you can pretty much accomplish what you need to just by eating a regular diet, meaning like different textures and types of foods. But oftentimes, doing a little bit of opening of the jaw, and sometimes putting the tongue on the roof of the mouth when you open, that kind of allows you to give yourself a little bit of a stretch through the jaw. And that tongue position can also kind of cue sort of the right tracking of the joint through there. So that's kind of an easy go-to if somebody might be having a little bit of jaw soreness, and maybe they tell me that, yeah, I've been eating a lot of really tough foods recently, like lots of bagels, pizza, that hard chewy dough, where maybe they've just overworked it a little bit. Sometimes doing a little bit of opening like that can be a nice way to sort of stretch out the jaw. The other thing is, oftentimes sometimes a jaw issue is isolated to the temporomandibular joint itself. Oftentimes it's coupled with some postural stuff and some issues in the head and neck. So other exercises that we commonly will prescribe, and again, just kind of depends on the person and what we think is driving what's going on and where their limitations are. But sometimes we do some neck stretches and some postural adjustments, especially sort of getting us out of this position and trying to get us a little bit more kind of upright here. So those are a couple common ones that we give, but again, like everything, it's sort of, we see where that person's specific limitation is, what are their specific drivers, and try to address those things.
So you look at the ergonomics a lot in terms of what might affect not just the physical, the body down here, but also even the jaw up there, huh?
Yeah, absolutely.
Yeah. Now, tell me something. There's been a lot of talk about the discovery or the deepening understanding of the microbiome system, and I know you're one, and Dr. Alley's is the other one that does a lot of deep dive in terms of research and getting information. So, tell me this: are there any studies showing correlation between our oral microbiome and our jaw health and flexibility?
Henry, I don't know of any, but to be totally honest with you, I have not. I mean, I've done a little bit of a dive into that. From what I can tell, it's a somewhat challenging thing to study, and I'm sure somebody is out there looking at it and dedicating their life's work to it. But I do not know, actually. I would be interested to find out, and I'm interested to look into that more. But at this point, I don't actually know about studies sort of looking at oral microbiome and jaw health and or flexibility. I'm sure there's a correlation there, but I don't know about it yet.
Yeah, I get you. It's just that they're finding out, man, the human body has more oneness to it than
Yeah,
than they previously discovered. You know,
right.
what affects the foot also might affect the lung. What
Yep.
affects you see and things like that. Again, vice versa. Now, tetanus was a big concern for folks years ago. In fact, these days, hardly anyone uses the term lockjaw. Have you ever come across this illness before? If so, where? What was it like?
So I have never come across this. So the good news, and a little bit of a hot topic right now because we're in the midst of vaccine gate with COVID. But essentially, tetanus has been taken care of. I mean, at least here in the US, and
Mm,
with the tetanus vaccine. So what it is, it's a bacterial infection that can cause your muscles to go into spasm. And oftentimes, some of the first muscles affected in that are the muscles in the jaw and the neck. And it's extremely serious when it happens, and extremely life threatening. So I'm happy that I have not come across that. But I think, I was looking through to see sort of the incidence of that. And I think the CDC says there's maybe 30 cases of tetanus in the entire US per year. And it mostly happens in individuals that are either not vaccinated or don't have their boosters. So it's again, a super life threatening medical emergency. And I'm happy that I have not come across it and that it is rare here these days.
indeed. I'm going to tell you what, I had to throw that out there because I've heard individuals talk about tetanus, and it kind of was a nice bridge into vaccines and the whole COVID situation. So, that said, with COVID-19 and the Delta variant prevalent right now in our society, there has been talk of there being a decline. They're seeing a decline, but it's still prevalent, and we don't know what can happen as far as that. Have you seen any symptoms related to the jaw and the neck muscles and the rest of the joints in the body as far as COVID, Delta, long COVID? What have you come across, or what have you even heard?
Yeah. Well, I mean, in my experience, I've seen a number of people kind of struggle with, everyone, not everyone, but a lot of people were working in their office away from home. And when the lockdown happened, many people moved their offices to their homes. And so in my experience, have worked with a number of people who struggling with a desk setup and getting things kind of aligned in a right way. Working at their dining room tables versus at an actual desk that's designed for work, that might be designed to go up and down. Sitting in a chair that might be designed to kind of support certain areas of our bodies and allow us to change position. So I've seen a lot of various kind of musculoskeletal, low back pain, neck pain, postural stuff associated with some of even just those simple workstation setup changes. Of course, that's, I think, pretty objectively, I don't know this for a fact, but I think pretty objectively, this has been pretty high stress situation for many of us. And we know that when the body's under that increased stress, essentially our thresholds for feeling things in our bodies are lowered. So it takes less of a stimulus for our bodies to maybe perceive something as threatening and give us that experience of pain. So things that maybe wouldn't normally bother us, or maybe we're able to sleep and recover better. Now in the presence of this increased stress, it affects our ability to recover and recharge at the end of the day, and we start feeling things more and more. So
Yeah.
both of those things are things that I've definitely encountered quite a bit working with people through this time. Long COVID kind of presents a lot. It's a whole host of other issues where we're still learning a lot about it, but essentially talking about thresholds again, like the body's threshold and capacity for activity, both mental activity and physical activity, essentially is limited. And my biggest question when I was looking at this, because my mom is actually struggling with this, is, is it okay to push those thresholds? And, is it okay to kind of work until you need to rest and then let yourself rest and keep working kind of against that threshold? And at least in my research so far, what I'm finding is that it's actually pretty important for people to not push the threshold. So to try to organize their day in a way that doesn't push them to the limit, so that they can operate by not pushing the threshold on a day-to-day basis. Their body's able to recover a little bit more, and over time they start to tolerate more and more activity.
That's excellent. It reminds me of some of the experiences that I've had with my clients. And one in particular, he was experiencing an enormous amount of stress, and it spilled over into depression because he moved his work to his home, and he was experiencing this basically negative energy almost 24/7, and it affected his back and everything else. What happened was, long story short, um, one of the things I did with him, the deep work, was have him totally pick a location in the house that would be strictly the office. Get yourself a chair that will support your back, an office chair.
Mm-hmm.
Get it out of the dining room. Get it, and then he do the things. Get all the things that make that space resemble your workspace at work in the
Mm-hmm.
office. And so once he did all that and he got the support, and we were always working on stretching and exercising, the stress levels went down, the depression went away. Then he started feeling much better. He was getting more sunlight, experiencing more joy, So that's so very important when it comes to that. And it affects, like we said, what affects one thing in the body, it affects the whole body.
Yep.
So
Yep.
it's
Absolutely.
important. That said, are there warm-ups that we can do before we perform any task?
So yeah, for sure. And this goes for the jaw, the head, the neck, anything that we're gonna do. You kind of think about Dr. Ali and I talk about like sort of priming the system. So if you've ever gone to any kind of athletic event, even I think like little league, like little kids, but especially like the collegiate professional levels, you never see a team get off the bus and walk to the field and start playing in their game immediately, at least under like normal circumstances.
Mm,
Um, so they're always warming up, right? You see them, little kids, like when I was in high school, we would do these kind of dynamic warm ups just to sort of get our bodies moving. Um, and so those things are really important. So we kind of break it down into what's going to be involved in the task, right? Whatever we're going to do, maybe we're going to go for a walk. And if you think about walking, well, there's a certain amount of arm swing that has to happen, a certain amount of spinal twist or rotation that has to happen. Oftentimes, we have to check and see if cars are coming, if we're crossing the road, so we know that we're going to be moving our neck. Our legs are moving back and forth. So, like, hips are bending into flexion, extension, knees are bending, ankles are bending. So, you kind of think about what is it that you're about to go and do. And before you do it, you sort of get your body warmed up. So before you go, and walking is a little bit of an extreme example. Most of us can kind of get away with a casual walk without a full on warm up. But it's relatable, right? Because most of us have gone for a walk, right? So you just sort of get your arms moving a little bit. Go ahead and sort of open that spine up a little bit, open up the head and neck motion, do a little bit of hip kind of stretching. Usually we won't recommend like doing like really long hold stretches before we go and do something, just because sometimes keeping a little bit of tension in our system can actually make the task a little bit easier, just because of the elastic kind of recoil from the muscles.
hmm.
But you just want to kind of prime the system. You want to get it moving in the way, and walking is a pretty a, for most of us, uh, lower intensity task when you compare it to something like baseball, where you're throwing at high velocities and sprinting. And so those kinds of things, you always see quarterbacks and pitchers and all these athletes. They're warming up with gentle throws, and then they're building into more intensity. So you just want to sort of get the joint fluid moving around, grease up the wheels, as we kind of say, and all those things are really, really important things. And we always say motion is lotion. So get things opened up and moving before you actually go and increase the demand of the task.
Absolutely, and most of us, especially the older we get, the more we love lotion. So,
Yeah.
listen, we often hear about or experience waking up with a stiff neck or a crick in the neck. But what causes that, and how can we fix it or prevent it?
Oftentimes, that crick in the neck feeling is a result of some kind of irritation, potential stiffness in either the joints and or the soft tissue or the muscles around the neck. So what we think happens is we might have our neck in like the same position throughout most of the night, and it might be our neck is designed to move in all these different kinds of directions, right? But hanging out all the way here for hours and hours may start to sort of overtax that area a little bit, or it's just in a position for a long period of time that it may not really be used to doing. So, you know, I think most people, I don't know the actual numbers on this, but I feel like most of us are going to experience a crick in the neck at least once in our lives. And I would say Um, you know, going back to the whole body stuff, like managing stress so that and making time for sleep so that you can sleep long enough and a good quality sleep, having whatever kind of pillow feels comfortable to you so that you can kind of support your neck a little bit. If a pillow feels comfortable to you, some people don't like to use pillows, and that's okay. But usually, allowing a really solid recharge. So managing stress before bed, making time for a nice sleep, and then thinking about your sleep position a little bit so that maybe you're not hanging out in this position for your 8 hours of sleep. Maybe you're a little bit closer to that sort of mid range. Those are some of the things that I think about, at least, when it comes to the crick in the neck. And then again, even if you do everything right, you're still probably going to get it at some point in your life. So, you always have that direction that you can't really turn. You got to turn your whole body to get there. So just sort of going with it, knowing that like it's going to get better, and you just kind of have to let it run its course. If you have a PT, if you have other healthcare providers, massage therapists, chiropractors, whatever it is that you like, sometimes we can provide a little nudge in the direction to get it moving and feeling better quicker. But otherwise, just sort of progressively working back into that motion as it allows you to.
Yeah. So here's a question, a little personal question. We know that you love the dog, love playing with your dog. We know you love hiking with the husband. But now, in terms of maintaining your own flexibility and joint health, do you do yoga?
I occasionally do yoga. I
How do
haven't.
you find it helping you? Tell me about it.
So I'll say, one of my favorite things about yoga is, at least the yoga that I do, is I like the freedom of movement, and maybe this speaks to what a novice I am, but when I go to a yoga class or I do an online yoga class, um, I enjoy the instructor being there and guiding us through the different movements and positions and things, and that variability of movement is awesome, because in most yoga classes that I've been in, at least, I get to move my body in ways that it is designed to move into, but I don't actually get to move in those ways throughout most of my life. So I like the fact that I'm able to sort of experience those movements and positions again, where I wouldn't otherwise be able to. And then again, if I can't nail a perfect downward facing dog, I can never get my heels on the ground. Like, it's just not going to happen.
Mm.
And I might have to bend my knees a little bit. And I just like the fact that I can do that. I'm showing up for the class. The instructor is there to show me what the proper thing to do is. But I know that even if I'm trying to get there, I don't need to force it. I'm still doing well by myself. And it's not like I have a teammate next to me that really needs me to get my heels down. Otherwise, we're going to, lose the match. I like that I can kind of have my own practice, take that time to breathe and move my body in ways that I wouldn't otherwise get. So I probably don't do it as much as I would like to. But I do enjoy it.
Well, your face just sort of lit up when I asked you about that. So I can see that it's something that you really enjoy. And that's a great thing. That's a great thing. I'm going to tell you something. Um, I think I've said this before. You're a remarkable young lady, and it is amazing to have you and Dr. Ali associated with the company. And just to observe the both of you in the way you work with my associates and dealing with and dealing with some of their ergonomic challenges, you guys are tremendously amazing. I really want to thank you for that. Last question. When I ask this to all of my guests this season, hopefully I'll continue asking you this question: what does it mean to you to crush your mountain?
Well, I think, at Proactivity, Dr. Ally and I, we preach like the 5 pillars, moving enough, fueling our bodies with good foods, basically, recovering well, so sleeping and active recovery strategies, having good social support systems, and being able to manage stress. And those things I really do think are kind of the pillars. And I think if we can hit on those things, we can start to crush our mountain. I think, beyond that, for me personally, it's about consistency and having some grace with yourself to kind of understand that, this is where I'm going. And I may not be making active steps up every single day. But if I can keep that point in mind, at least to me, other things are going to come up, and occasionally we're going to have to prioritize other things over ourselves sometimes. And I think that's okay, as long as it doesn't become the norm, right? We want to keep that ultimate goal in mind. But I think sticking through, realizing it's about the journey and consistency of it, and being willing to sort of give yourself a little bit of grace and know that, okay, maybe I wasn't my best at crushing my mountain today, like getting where I want to go, but I'm still on this journey and I'll get back to it tomorrow. And that's okay. It doesn't mean that I've fallen off the mountain. I just, I'm just taking a little kind of break recovery part on the, little camp out here on this part of the mountain, and we'll get back to it.
Dr. Carley, you are certainly one who is doing just that. And I love your perspective in crushing through the mountain, because when you think about it, you're making a tunnel. And tunnels are not built in one day, not built in a week or a month, sometimes not even a year. But it is the progressive determination of getting through to the other side and seeing the daylight that you know is there. And so, I want to again thank you for your medical wisdom and insights, your personal understanding of things, and your deep feeling and sensitivities to those who might be either suffering or trying to prevent possible suffering in terms of their joint health and flexibility. Hopefully again we'll have you on at another time. We might talk about the health benefits of playing with black labs. I don't know.
Hey, that would be great.
Yeah.
Well, thank you so much, Henry. It's been quite an honor to be with you today. I really appreciate you reaching out and being interested in what I have to say.
Oh, absolutely, absolutely. Always good to get information, and as we get older and we grow in our wisdom, we also tap into the wisdom of those who have experience in other areas, and they may be younger, they may be older, they may be of different backgrounds, but there is a collective wisdom that comes from our working and thinking and sharing together. In the meantime, like I always say, don't just climb your mountain, crush through it. We'll see you next time.